45! No more bullshit! Blue Shield stands for BS. Blue Shield stands for BS.
Prop 45 does one simple thing. It requires that the state have the ability to reject an excessive health insurance rate. 35 states have it, but not California. You would never know from the advertising that 4 health insurance companies, including Blue Shield, has spent trying to kill Prop 45, that insurance companies are even involved, or insurance rates are even the issue. Blue Shield's kicked in $9.5 million of the $37 million to stop Prop 45. When was the last time an insurance company spent $37 million because they wanted to save you money? They're fighting Prop 45 because Prop 45 is going to save consumers billions and billions of dollars. The California Nurses Association are for Prop 45, and if you look at the insurance company ads, you'd believe there are the 85,000 California nurses that are for Prop 45 are against it because they have nurses in their ad. Well, we have the organization that represents nurses. You'll be hearing from Harvey Rosenfield, who wrote the auto insurance reform 25 years ago that has brought auto insurance rates in this state down in real dollars since 1975. Auto and home insurance companies in this state have to get permission before raising rates. And that's why rates for auto are lower now than they were in '88 because of that reform. And all Prop 45 does is extend the existing regulation we have for auto and home to health insurance. Blue Shield wants to complicate it with misleading ads. We're not buying their bull. And all this initiative is about is making sure that the 6 million individual and small business owners who cannot afford health insurance have the right to have their state reject excessive rates. We all have to buy health insurance under federal law, but there is no agency in California that guarantees it's affordable. It's a travesty. It's actually BS. And we're here today to make that statement. So let me bring up Joan Ehrlich, who is a Blue Shield policyholder, who was quite surprised at her treatment by this company, a not-for-profit company, that while it's raising rates and cutting networks of doctors and changing its promises, is sitting on literally 1,600% more in investment reserves, $4.4 billion, 1,600% more than the state requires. It's just raking in the cash, while policyholders like Joan can't get what they deserve.
I had Anthem through my employer for many years, and I saw the premiums going up even though it was an employer-paid plan. Now I'm in my first year with Blue Shield through Covered California, and I'm being hit with huge increases in cost, much higher than my COBRA was through Anthem. I chose the most expensive Covered California Platinum PPO with Blue Shield. The value of the plan is $830 a month. That's not nothing. It was supposed to cover my doctors, have no deductibles, and nominal fixed co-pays. I was very diligent in researching my health plan before I enrolled. I took a list of my doctors and facilities and checked if they were in network. I checked the Covered California website. I called Covered California. Then I checked the Blue Shield website. Then I called Blue Shield and checked name. Then I called every single doctor and confirmed that they were accepting this insurance. Having done all of that, I enrolled in December in time to get insurance by January 1st. But instead of this promise of platinum treatment, I am paying out-of-network costs for provider care that the Blue Shield website says or said is covered. I was told my copay would be either $20 or $40. Instead, I am paying the copays plus 50% charge for the doctors. On top of that, my employer provided dental and vision, and this plan does not. So in addition to paying for this, I'm also paying for dental, and I'm choosing to go without vision. I can't make head or tail of all the bills and paperwork they have sent me. One document says that of the 1,374 paid to providers from February through September, I had to pay $511.68. Another bill for $589. Another bill to me was $589 for $650 of services. That's not a $20 copay. I have another bill for a copay of $58 for an in-network doctor visit. In reality, I also had to pay an additional $324 for $386. I have a bill for $269 for $337 worth of services, and another for $269 I'm paying of $337 of services. I have a copy of a Blue Shield website printout dated September 15th showing showing that my gynecologist is in network. But I called her, and she does not take Covered California, even though she was a doctor I checked before enrolling. I actually went to see her today. There were 3 other people in the office who had chosen that doctor. They also had Blue Shield, Platinum, PPO, and that's why they had chosen the doctor. And they were freaking out that she doesn't take Covered California, even though, as of this morning, Blue Shield says she's in the plan. I spent literally hundreds of hours on the phone trying to resolve this. I finally spoke to Covered California and was advised and filed grievances with Blue Shield, requesting that they pay for the services that were supposed to be covered. They were both summarily denied on the grounds that the providers were out of network. They took the grievance verbally over the phone. I was not allowed to write my own grievance nor read it when they submitted it. The result is that they did not address my concerns when I filed the grievance. This is why I support Proposition 45. This is a power that the insurance commissioner already has over audit and other things. The cost of those things went down. I want someone I vote for to control plans and costs, not some industry-picked group. It certainly did not work out very well for me this year. Insurance regulators exist in 35 states. I think the citizens of California deserve the same. Thank you.
There were $250 million in rates that were deemed to be excessive for small business owners by state regulators, but went into effect anyway because we don't have Prop 45. Regulators can't say no to unreasonable rates even when regulators find them unreasonable. And there were small business owners, there are 3.5 million of them in the state. And $250 million in rate hikes were recently declared unreasonable by those regulators who oversee these plans, but they couldn't stop them. And Prop 45 gives them the power to stop them. I'd like to bring up a nurse from the California Nurses Association. I don't know if it's going to be Kathy or Maureen, to say a few words because they have been a supporter of Prop 45. They're 85,000 people strong. And the other side likes to say nurses are on their side, but we got the real nurses, not the ones who are denying care on the 1-800 hotlines.
I believe that Prop 45 is the first step in accountability. We have an insurance industry that has no accountability. There are people who pay incredible premiums and are yet denied the care that they need because it's not covered by their plan. We have people who have signed up and pay tremendous amounts of money only to find out that their doctors, after they're in the plan, opt out of the network. I had a dear friend who had hip surgery. The interesting thing was she had the private insurance. I'm not sure if it was Anthem or if it was Blue Cross or Blue Shield, but she had surgery. But the physicians, the surgeons, the only surgeons in her area that would take her plan, and it was a covered California plan, operated at a hospital that was not covered. So the physicians were covered, the hospital wasn't. If she went to a hospital that was covered, the physicians didn't do surgery there. So she had to get a special arrangement to actually have her surgery with these doctors. It was a hip surgery. Post-operatively, the doctors left the covered California within 1 week of her having her surgery. So all the orthopedic surgical patients, many of them elderly, who really had only one place to go, were left with no doctors for post-operative care. There are other people, I know of others, like in Santa Barbara, for instance, who have the Blue Cross plan, but none of the doctors in her area are accepting new people. This is a 42-year-old woman who has not seen a gynecologist in 10 years, and yet there is not a gynecologist who will accept the payment that the insurance companies will give. Another situation, actually a friend of mine who's a doctor went to get her mammogram, and she was surprised to get a bill because the actual mammogram was covered, but the reading of the mammogram was not covered. So you can get a mammogram, but if you want to know what it says, forget about it. So my point is that the insurance companies offer no value to this system, and Prop 45 is the first opportunity we have at making them accountable. They can afford $30 million salaries for their CEOs. We need to get rid of that. That is not necessary. That is not health care. We want every dime and every penny to go towards health care, not towards profit and not towards CEO salaries. Thank you.
I'm here today And Californians need to be yes on 45 because we've been betrayed. Back in the 1980s, the state legislature mandated that California consumers buy auto insurance. But guess what they forgot? They forgot to put any protections in that mandate against how much the auto insurance companies could charge us when we went to them to comply with the law. And not surprisingly, as soon as the law passed and we were all required to buy auto insurance, they jacked our rates up through the roof. Well, that led to a voter revolt in California. And I thought you all might be interested to hear a little bit about what the insurance industry said when they spent $63 million back in 1988 trying to stop consumers from passing Prop 103. So I opened up the ballot pamphlet, which here's a copy of it. This is the ballot pamphlet from 1988. And I'm going to read you what the insurance industry said Prop 103 would do. It said Prop 103 will increase rates. The insurance industry said it will create a massive insurance bureaucracy. The insurance industry said Prop 103 does not reform our system. It said there will be more litigation. The insurance industry back in '88 said this insurance czar, they're talking about the provision in Prop 103 that made the insurance commissioner accountable directly to the voters. They said this insurance czar would be a politician first. He'd be preoccupied with raising campaign money from special interests, all too willing to buy influence. If it sounds familiar, that's because it's the same BS, the same BS that Blue Shield and the other three insurance companies are spending to try to convince California voters to vote against their own pocketbook. The reason why people have to vote yes on 45 is because when they voted yes on Prop 103 back in 1988, what happened? It passed, first of all. Within 5 years, reports showed that it had saved $4.2 billion for motorists in California. And just last year, 25 years after the passage of Proposition 103, the Consumer Federation of America issued this report showing that 103 had saved motorists in California over $100 billion since 1988. California is the only state in the nation where the average auto insurance premium has gone down. It's lower now. It's lower now in California than it was back in 1988. That is why California citizens need to vote yes on Prop 45. Don't pay any attention to the BS that's being dumped in our living rooms by the insurance companies. $37 million and counting so far. But if you vote yes on 45, you will start to see savings that we estimate would average $625 per household in California every year. $1 billion of savings a year from regulating the insurance companies. The politicians betrayed us in Sacramento. Congress required us to buy health insurance, but just like what happened back in the 80s with auto insurance, they didn't pass any protections against how much these health insurance companies, that all they care about is Wall Street, how much they would charge us for our premiums. We have to take matters into our own hands by voting yes on 45.